If you're over 60 and waking up at night because your feet feel like they're on fire, or you're constantly feeling like invisible bugs are crawling on your legs, what I'm about to share could be life-changing. Most doctors run straight to diabetes tests and prescription medications. But there's one simple vitamin deficiency that gets overlooked in up to 40% of seniors, and it could be the real reason behind your leg numbness and tingling. I'm Dr. Naira, and today I'm going to explain the vitamin that neurologists often miss, the one that could reverse your symptoms before permanent nerve damage sets in. Stay with me, because what you learn in the next few minutes might save you years of unnecessary suffering. Let me start by sharing something that happens in examination rooms across the country every single day. I hear the same complaints over and over from patients in my practice. They tell me their feet hurt so badly that they can't stand the feeling of bed sheets touching them at night. Others describe sensations that sound almost unbelievable, like bugs biting the bottom of their feet, even though nothing is there. These aren't imaginary symptoms. They're real. They're distressing. And for many people over 60, they're the first warning sign that something serious is happening inside their bodies. Here's what most people don't realize. These sensations, the burning, the tingling, the numbness, they're often the first clear sign of a condition called peripheral neuropathy. Now, I know that sounds like complicated medical jargon, but stay with me because understanding this could change everything for you. Peripheral neuropathy is damage to the nerves that branch out from your brain and spinal cord to the rest of your body. These nerves are like the electrical wiring in your house. They carry signals that let you feel when something is too hot, too cold, or too tight. They tell your muscles when to move. They even control things you don't think about, like your digestion and blood pressure. When these nerves get damaged, the signals get scrambled or blocked entirely. That's when you start experiencing those awful sensations in your feet and legs. For most people, doctors immediately think diabetes. And yes, diabetes is the #1 cause of peripheral neuropathy worldwide. About half of all people with diabetes will develop some form of nerve damage. But here's what shocked me when I started researching this topic. In roughly 1/4 of neuropathy cases, doctors can't find an underlying cause at all. Patients get tested for diabetes, they get tested for thyroid problems, they run through a whole battery of expensive tests and everything comes back normal. Meanwhile, their symptoms continue or even get worse. This is where the story gets interesting, and frankly, a little frustrating. There's one simple, inexpensive blood test that often gets skipped, and it checks for something that could be causing all these symptoms. I'm talking about vitamin B12. Now, before you think this sounds too simple to be true, let me explain why this vitamin is so critical, especially for those of us over 60. Vitamin B12 plays an absolutely essential role in nerve health. Think of it as the insulation around the electrical wires in your nervous system. I'm talking about vitamin B12. Now, before you think this sounds too simple to be true, let me explain why this vitamin is so critical, especially for those of us over 60. Vitamin B12 plays an absolutely essential role in nerve health. Think of it as the insulation around the electrical wires in your nervous system. Without enough B12, that insulation starts to break down. The signals can't travel properly. That's when you start getting tingling, numbness, pain, and weakness. The scary part is that B12 deficiency can cause the exact same symptoms as diabetic neuropathy, but it gets overlooked constantly. Why does this happen? Because many doctors are trained to think of the most common causes first, which is diabetes, and they don't always check B12 levels unless the patient specifically asks or unless other tests come back negative. Here's something that really opened my eyes. As we age, our ability to absorb vitamin B12 decreases significantly. Some estimates suggest that up to 20% of adults over 60 have low B12 levels, and many don't even know it. This happens for several reasons. First, our stomachs produce less acid as we get older, and we need that acid to extract B12 from the food we eat. Second, many seniors take medications that interfere with B12 absorption. Common drugs like metformin for diabetes, proton pump inhibitors for heartburn, and even some antibiotics can deplete your B12 levels over time. Third, some people have conditions where their bodies can't absorb B12 properly, no matter how much they consume. Let me paint you a picture of how this typically unfolds. You're in your 60s or 70s, and you start noticing your feet feel a little numb or tingly, especially at night. Maybe you're having trouble with your balance. You mention it to your doctor during your annual checkup. They run a fasting blood sugar test and maybe an A1C test to check for diabetes. Those tests come back borderline or normal. They tell you it's probably just part of aging, or maybe they prescribe you a pain medication. Months go by, maybe even years, and your symptoms slowly get worse. What nobody checked was your B12 level, and all this time, your nerves have been slowly deteriorating because they're not getting the nutrition they desperately need. Now let me be clear about something important. I'm not saying that every case of leg numbness or neuropathy after 60 is caused by B12 deficiency. That would be irresponsible and inaccurate. Diabetes, autoimmune diseases, infections, certain medications, exposure to toxins, and even genetic factors can all cause neuropathy. What I am saying is that B12 deficiency is a common, treatable, and often overlooked cause that deserves attention, especially in the over 60 population. The good news, and this is really important, is that when B12 deficiency is caught early, the nerve damage can often be reversed. I've seen this happen many times in my own practice. When patients come in with early symptoms and testing reveals low B12, treatment with B12 supplementation can stop the progression and even reverse some of the damage. But here's the critical part. If you wait too long, if the nerve damage becomes severe and permanent, even correcting the B12 deficiency won't fully restore your nerve function. That's why early detection is absolutely crucial. So what are the symptoms you should watch for? Beyond the obvious foot and leg numbness and tingling, B12 deficiency can cause a whole range of symptoms that you might not connect to a vitamin problem. You might feel unusually tired or weak. You might notice you're getting short of breath more easily. Some people develop a sore or swollen tongue. Others experience mood changes, including depression or memory problems that could be mistaken for early dementia. You might feel unsteady when you walk or have trouble with balance and coordination. Some people describe a feeling of wearing invisible socks or gloves, even though their feet and hands are bare. Here's what makes this especially tricky. These symptoms often develop so slowly that you might not even notice them at first. You adapt to feeling a little more tired. You chalk up the balance issues to getting older. You don't connect all these dots until suddenly you realize your quality of life has significantly declined. That's why I'm so passionate about raising awareness of this issue. Too many seniors are suffering needlessly when a simple blood test and treatment could make all the difference. So let's talk about how you can get tested and what to do if your B12 levels are low. First, you need to ask your doctor for a B12 blood test. Don't assume it's been checked as part of your routine blood work. It often isn't unless specifically requested. The test is simple, inexpensive, and covered by most insurance plans. Normal B12 levels are generally considered to be above 200 picograms per milliliter. But here's something important that many people don't know. Some experts believe that levels below 400 can still cause symptoms in some individuals, especially neurological symptoms. So even if your doctor says your level is technically normal, if you're experiencing symptoms and your level is on the lower end of normal, it might be worth discussing treatment anyway. If your B12 is low, treatment typically involves either high-dose oral supplements or B12 injections. For people with absorption problems, injections are often more effective because they bypass the digestive system entirely. Many patients start with weekly or monthly injections until their levels normalize, then switch to maintenance doses. Some people need to continue treatment indefinitely, especially if they have an absorption problem that can't be corrected. The good news is that B12 is water-soluble, which means your body excretes what it doesn't need, so it's very difficult to take too much. Now let's talk about prevention, because this is just as important as treatment. You can reduce your risk of B12 deficiency by making sure you're getting enough in your diet. Vitamin B12 is found naturally in animal products like meat, poultry, fish, eggs, and dairy. If you're vegetarian or vegan, you're at higher risk and should definitely consider fortified foods or supplements. Even if you eat plenty of animal products, remember that absorption is the issue for many seniors. That's why some experts recommend that everyone over 50 take a B12 supplement as a precautionary measure. I also want to address the full picture of what can cause peripheral neuropathy, because it's important to understand. Diabetes remains the leading cause, affecting about half of all people with diabetes. If you have diabetes or prediabetes, blood sugar control is absolutely critical. Certain medications, especially chemotherapy drugs, can cause nerve damage as a side effect. Some infections, including Lyme disease and even COVID-19, can trigger neuropathy. Autoimmune diseases like lupus and rheumatoid arthritis can attack your nerves. Excessive alcohol consumption is toxic to nerves, especially when combined with poor nutrition. Exposure to toxins can damage nerves, and there are rare inherited forms of neuropathy that run in families. In about 25% of cases, doctors can't identify a specific cause, but many of these patients share risk factors like obesity, high cholesterol, and high blood pressure. The underlying damage mechanisms might be similar to diabetes even without an official diabetes diagnosis. This is why overall metabolic health is so important as we age. So what should you do if you're experiencing leg numbness, tingling, or pain? First, don't ignore it. These symptoms are your body's way of telling you something is wrong. Schedule an appointment with your doctor and be specific about your symptoms. Tell them when the symptoms started, how often they occur, whether they're getting worse, and how they're affecting your daily life. Ask specifically for your B12 level to be checked, along with tests for diabetes, thyroid function, and any other relevant screening. If you do have neuropathy, work with your doctor to identify and address the underlying cause. Control your blood sugar if you have diabetes. Correct any vitamin deficiencies. Review your medications to see if any could be contributing. Make lifestyle changes like eating a healthier diet, exercising regularly, avoiding alcohol and smoking, and maintaining a healthy weight. All of these things support nerve health. For foot neuropathy specifically, establish a good foot care routine. Check your feet daily for cuts, blisters, or sores. Wear comfortable shoes that fit properly. See a podiatrist regularly. Because neuropathy can reduce sensation in your feet, you might not notice injuries that could become infected. Prevention is key. Here's my final message to you today. Your symptoms matter, your quality of life matters. You deserve answers, and you deserve treatment that addresses the root cause, not just masks the symptoms. Don't let anyone dismiss your concerns as just part of getting older. Leg numbness, tingling, and pain are not normal parts of aging. They're signs that something needs attention. If you take away just one thing from this video, let it be this. Ask your doctor to check your vitamin B12 level, especially if you're over 60 and experiencing any neurological symptoms. It's a simple test that could reveal a simple solution to what might feel like a complex and frightening problem. Caught early, B12 deficiency and the nerve damage it causes can often be completely reversed. That's the kind of outcome we all want. I hope this information empowers you to take charge of your health and have informed conversations with your healthcare providers. Remember, you know your body better than anyone else. Trust your instincts, advocate for yourself, and don't stop asking questions until you get the answers you need. What's your experience with leg numbness or B12 deficiency? Have you had your levels checked? Share your story in the comments below. I read every comment, and your experiences help others in our community feel less alone. Thank you for being here, and remember, your health is your greatest wealth. Take care of yourself, listen to your body, and never stop being your own best health advocate.